We're live.
Hey guys, it's Dr. Emer, and we're here with one of my beautiful patients who is like many of my darker skin patients that have pigmentation that develops on their skin. Sometimes it happens with pregnancy, sometimes it happens with age, sometimes it's sun, sometimes it just happens hormonally, internally, and we call that melasma. And one of the treatments that we do as a combination is something called Aerolase, which we're doing right now. This is a 1064 microsecond laser. In the past, my dark skin patients had nothing that they could do to help improve pigmentation besides peels and skincare. But now we have these new technology of lasers like this one that literally bypasses the upper surface of the skin. It goes underneath the skin to try and break apart the pigment. The other thing it does is gets rid of hair, so you guys can see any little hairs that she has there, they're getting attracted by laser. She's gonna get a little hair removal for free, which is great. I don't know any woman that wants to have a hairy face. Is that true? You guys agree or disagree? I agree. So the other thing I want you guys to know is we're gonna combine this with another laser called Clear and Brilliant that's going to work on the surface, and that's going to help exfoliate the pigment. Typically you bronze a little bit the first couple days to a week, and then it slowly starts to lighten with the combination of lightening creams. Make sure you tell me what people are saying.
Unlocked Joy 88 is saying you're making someone beautiful as usual.
We'll do our best. We want people to feel good about themselves. And you know, my patient here, just so you guys know, has struggled with pigmentation for a very long time on her face. And one of the things we did first was get her on skincare and a Cosmelan peel. And I would say it's significantly improved. And it's one of those things where we're gonna have to maintain it. We're gonna have to do more of the peel, but this is our initial starting point to really making her have a new life with her skin and feel comfortable in her skin. And so we're doing exactly what needs to be done. So a couple weeks ago, she did her Cosmelan. You can see she's still a little irritated on her skin, which is fine. But now we're using the 1064 to break apart this pigment. I'm gonna have you turn to the left now. The other great thing about this laser is it decreases inflammation. So patients that have acne or sensitive skin like rosacea, they improve dramatically. You can see many micro pulses, high energy laser, minimal downtime because it's not affecting the surface.
And how does it feel? Any pain?
How does it feel?
Just
Just a little bit of heat.
no pain.
She's strong. You guys know my women are always strong. They typically don't feel much. Over the areas of hair, she might feel a little bit more, but it's not too bad, right?
No, it's no pain at all. Just
Great. A lot of big problem area for women is their lateral cheeks, their upper lip, and on the forehead. So we want to make sure we're really aggressive in treating those areas.
And what's problematic about those areas?
That's where we get the pigment. That's where the pigment starts to come. It's called the mass of melasma. It can occur in those areas. So melasma, again, is a hormonal or internal related pigmentation. Sometimes it's sun, sometimes it's medicine. A lot of my women on birth control start to develop this, and it goes out of control. Not a lot of my women trying in vitro fertilization, hormone therapy can get this. So we really need to be very specific about how we treat this. And so what we're gonna do after this is she's gonna have an aftercare protocol on what to do for her skin. And then we're gonna enhance the Cosmelan by staying on the Cosmelan 2 for a couple more weeks, and also adding something called Vivacia, which is a foam brightening agent. And it's really good on the body, but in this instance, we're actually gonna use it on the face.
Akani Claus says she's gonna glow.
She is totally gonna glow. That's my goal. And she's already glowing. She's so much happier given that her initial pigmentation went down a lot. You know, you feel much more confident to go out now?
Yes.
That's all I care about. That's the most important thing. So I really want her to go out and have a great life, do what she loves to do.
And someone's asking, what treatment would you suggest for open pores? Does this work for enlarged pores?
This decreases pores in those that are oily. Also, the Clear and Brilliant, which we're going to do next, is the most improvement because it shrinks in the pores. Okay? Now, with her, we can't do stronger lasers, but in a lighter skin tone, we could do Halo, Fraxel, microneedling, and PRP. Today, we're going to do microneedling and A-cell, which is a stem cell product to help her recover her skin much more quickly. But overall, you guys can see this is what Aerolase does. Frequent, high energy, microsecond pulses to help break apart this pigment. Alright, we're going to finish the treatment and we'll be back when we do the Clear and Brilliant microneedling and PRP. Bye!